Anesthesia during the first birth. Contractions. A primigravida was admitted to the maternity hospital without undergoing physical psychoprophylactic training. The beginning of the first stage of labor has been established. Blood pressure is normal. In such a situation, Seduxan, which belongs to the group of ataractics, can be used to obtain a sedative effect. 2 milliliters of a 0.5% solution, 10 milligrams, are administered intramuscularly. It is advisable to administer Aprofen and Noshpa intravenously in a glucose solution. They have an antispasmodic effect on the cervix and, in addition, Aprofen increases the contractile activity of the uterus. The pregnant woman's contractions are frequent, but her behavior has become calm. When the uterine pharynx is opened by 4 centimeters or more, you can administer a mixture of 20 milligrams of diphenhydramine and 20 milligrams of Promedol in a glucose solution. The combination of the ataractic, Seduxena, with the central analgesic, Promedol, is called Ataralgesia. This woman in labor began to give birth at 2 o'clock in the morning. She did not sleep. She was tired, the contractions became less frequent and weakened somewhat. The opening of the uterine pharynx is 5 centimeters. Before deciding on the need for labor stimulation, it is necessary to provide the woman with rest. It was decided to do this using steroid anesthesia. Viadril has a pronounced anesthetic effect, leading to sleep within 2 to 3 hours. 500 milligrams of Viadril G are diluted with 10 milliliters of a 0.25% solution of Novocaine and administered intravenously quickly. To obtain an analgesic effect, pre-medication with Promedol with diphenhydramine is necessary. Viadril relaxes the striated muscles, but ensures good contractile activity of the uterus and rapid opening of the uterine pharynx. During steroid anesthesia, it is necessary to monitor the condition of the woman in labor. During sleep, the contractions continue and intensify. The fetal heartbeat does not change. By the beginning of the effort, the woman in labor wakes up, and the baby is born without signs of respiratory depression. This woman in labor at the end of the first stage of labor. The contractile activity of the uterus, which is recorded by the device, is good. The opening of the uterine pharynx is 8 centimeters. By the end of the first, at the beginning of the second stage of labor, it is undesirable to administer analgesics by injection, since their concentration by the time the child is born can remain high and cause respiratory depression in him. Here it is more advisable to use inhalation autoanalgesia. The most common is inhalation of nitrous oxide with oxygen using the NAP60 or Autonarcon devices. The oxygen concentration is indicated on the dosimeter. The supply of nitrous oxide is limited to 75%. Its concentration can be changed individually for each woman in labor. Here's another woman at the end of her first stage of labor. The woman in labor is trying to push, but premature pushing will tire her and can cause placental circulatory disorders. Pain relief should be done by inhalation. In addition to nitrous oxide, you can use Pentran or Trilene. Pentran at a concentration of 5.8% by volume provides good analgesia. A simple gas air inhaler, Trilan, is used, which the woman uses only during contractions. The gas is quickly eliminated from the body after cessation of autoanalgesia. Pentrin can also be used through a manual evaporator, analgesia. After the required concentration of anesthetic, the woman in labor falls asleep and the device loses its seal.